The autonomic nervous system can control cardiac output by adjusting heart rate and/or stroke volume. Cardiac output is defined as the heart rate times the stroke volume. So let's look at an example. If my heart rate is 60 beats per minute, that's also a pulse, and my stroke volume is 70 milliliters per beat, then I multiply the two across and I get 4,200 milliliters per minute, or 4.2 liters per minute. That basically is an indicator of how much blood is leaving my left ventricle per minute. And it's another way to assess how much blood is circulating around my body per minute. Let's explore stroke volume in a little bit more detail. Here I have an image of a heart, and I'm outlining the left ventricle. When the left ventricle undergoes a contraction, it's actually a twitch that generates force, and that tension creates pressure. When the pressure in the ventricle exceeds the pressure in the aorta, blood is ejected. Now, a common misconception is that all of the blood is ejected, but on average, it's actually only about half of the blood is ejected. So the stroke volume is in fact the amount of blood that is ejected in one ventricular contraction, and it's usually, although not always, about half of the blood in the ventricle. A theme that we need to understand is that the greater the tension generated during a ventricular twitch, the more pressure will be generated in the ventricle and the more blood will be ejected. So that will increase the stroke volume. Hopefully it's obvious that when we look at cardiac output, we can increase the cardiac output by increasing either the heart rate and/or the stroke volume. Let's take a look at an example. In this example, I'm going to increase both the heart rate and the stroke volume, and we'll see that the cardiac output also increases. Now, just as a reminder, cardiac output is a measurement of how much blood circulates around the body per minute. By increasing the cardiac output, you increase the amount of oxygen and nutrients delivered to cells. So if we increase our heart rate and/or stroke volume, we increase cardiac output. And the sympathetic nervous system is capable of doing both of these things. The autonomic nervous system is broken down into two branches, and we've already covered these branches. They are the parasympathetic nervous system and the sympathetic nervous system. Let's take a look at how both of these branches impact and govern the cardiac output. The parasympathetic nervous system works predominantly by slowing down the heart rate. So it actually has a negligible effect on stroke volume. Its primary mechanism of control to reduce the cardiac output is to slow down the heart rate. In contrast, the sympathetic nervous system both increases the heart rate and increases the stroke volume. Now, we've already covered how it increases the heart rate, so let's explore a little bit more about how the sympathetic nervous system can increase the stroke volume. Here's the rationale. Now, I've already said the primary way to increase stroke volume is to increase the amount of pressure that is generated in the ventricle during the contraction. Well, how do you do that? Well, remember, when the ventricle contracts, it's actually undergoing a twitch. So in order to increase the tension in the ventricle, you have to increase the tension of a twitch. That's right, you actually have to grade that twitch to be stronger. Now, the way you do that is by forming more cross bridges. How do you form more cross bridges? By increasing the amount of calcium available to bind to troponin. This gives you an overview of how the sympathetic nervous system can impact stroke volume. Now we're going to turn and actually look at the mechanisms by which the autonomic nervous system modulates cardiac output. Make sure to take good notes here. We'll start with the parasympathetic nervous system. We know that the parasympathetic nervous system only impacts heart rate. So therefore, parasympathetic neurons are only going to synapse on the sinoatrial node. Their neurotransmitter is acetylcholine, and when acetylcholine binds to receptors on those autorhythmic cells, the outcome is to change how the voltage-sensitive potassium gates behave. They delay the closing of those potassium gates, and what this does is hyperpolarizes the membrane potential during the pacemaker potential portion. So this effectively increases the length of time of that pacemaker potential. The longer it takes for that pacemaker potential to reach threshold, the fewer number of action potentials are generated in a minute, and therefore the lower the heart rate. So again, the outcome here is going to be to lower the heart rate by increasing the length of time for the pacemaker potential, and that's done mostly by hyperpolarizing the membrane potential. Let's turn our attention to the sympathetic nervous system. The sympathetic nervous system causes both an increase in heart rate and an increase in stroke volume. Now, we've already covered the mechanisms by which the heart rate is increased, so we'll recap here briefly. The neurotransmitter that is secreted by sympathetic neurons is largely norepinephrine, though occasionally epinephrine is secreted as well. The receptors in this case are called beta-1 receptors. When norepinephrine binds to beta-1 receptors in autorhythmic cells, it changes how the IF gates behave. It untwists them and makes them more permeable. The consequence, of course, is that the pacemaker potential is going to be shorter and steeper. And this leads to a shorter time before the pacemaker potential reaches threshold, and therefore more frequent action potentials in a minute. In other words, a faster heart rate. To increase the stroke volume, the ventricular twitch is graded or modulated. Now, in skeletal muscle, not cardiac, but skeletal muscle, twitches cannot be graded, but in cardiac muscle, they can. So let's take a look. If I draw here a default twitch, both in terms of tension and time, with my black line, once the sympathetic nervous system has gotten a hold of those ventricular myocardial cells, the twitch approximates what we see with the red line. So in other words, the twitch is both stronger, as you can see there by the greater tension, but also shorter. So it is both a stronger and a shorter twitch. And it is both of these together that end up leading to a greater amount of blood being ejected from the left ventricle, and therefore a greater stroke volume. So our last topic then is, how does the sympathetic nervous system create a stronger and shorter twitch? Let us consider how we might increase the tension of a twitch and also make a twitch shorter. We'll start with the first one, which is, how do we increase the tension of a twitch? Tension is directly proportional to the number of cross bridges that are formed. So the more cross bridges are formed, the greater the tension. Well, how could a cardiac cell increase the number of cross bridges? It could expose more binding spots for the myosin heads. And it does that by increasing the amount of calcium that is out in the cytosol. So the obvious solution is to somehow release more calcium from the sarcoplasmic reticulum. More calcium will bind to more troponin, thus ensuring more cross bridges. And what about making your twitch shorter? How do you make a twitch shorter? Well, you do that by removing calcium faster from the cytosol. So how could you remove calcium faster? Well, what does the bulk of calcium removal? And that is calcium ATPase embedded in the sarcoplasmic reticulum. So let's somehow supercharge our calcium ATPase so that it works faster. In doing so, it will remove calcium from the cytosol faster, and therefore cover up those binding spots faster and therefore make a shorter twitch. Interestingly enough, this is exactly what the sympathetic nervous system does when it triggers our contractile myocardial cells. The main effect or outcome from the sympathetic nervous system is to modulate our calcium ATPase so that it's supercharged. It works faster. Now, what's even more interesting is that getting the calcium ATPase to work faster actually achieves both of our goals. It might seem obvious that when calcium ATPase works faster, that it shortens the twitch time, but it turns out that it also creates a stronger tension. How does that work? Well, let's take a look at the next animation to see if we can demonstrate how supercharging calcium ATPase actually leads to a stronger twitch. So consider my drawing of a myocardial contractile cell. Imagine that I have an action potential going across the plasma membrane, and it opens up that L-type calcium gate, and that allows some of the calcium from the extracellular fluid into the cell. We're going to presume that the L-type calcium gate is open long enough to allow 5 calcium ions to move from the extracellular fluid to the intracellular fluid. We know that some of that calcium will be trigger calcium and some will actually bind to troponin directly. So we're going to say that we get 5 calciums from the extracellular fluid. Well, some of that calcium, as I said, is trigger calcium, and it's going to open up the gate and allow 45 calcium ions that I have stored in that sarcoplasmic reticulum out into the cytosol. So we're going to have a total of 50 calcium ions in my example, 5 from the extracellular fluid and 45 from the sarcoplasmic reticulum. So I'm going to line up all 50 calcium ions for you. Obviously, typically these would be bound to troponin, but what I want to do is talk about putting them back. If 5 came from the extracellular fluid and 45 came from the sarcoplasmic reticulum, then we should be putting 45 calcium ions back into the sarcoplasmic reticulum, and we should be putting 5 calcium ions back into the extracellular fluid. In other words, you return the calcium ions at the same proportion that you got them from. And how does this happen? It happens because calcium ATPase works at a particular speed that tends to grab about 90% of the calcium that is in the cytosol, and the rest gets grabbed by that sodium-calcium antiport or cotransporter. So here we're just kind of quickly pumping that calcium back into the sarcoplasmic reticulum and occasionally kicking a calcium ion back out into the extracellular fluid. And by the time we're done with all of this, we have returned 45 calcium ions to the sarcoplasmic reticulum and 5 calcium ions back out into the extracellular fluid. Let's consider another example. This time we're going to supercharge calcium ATPase because the sympathetic nervous system is going to release norepinephrine on the beta-1 receptors of the myocardial contractile cells. When calcium ATPase works super fast, it pumps more than its fair share of calcium back into the sarcoplasmic reticulum, leaving less calcium to be pushed back into the extracellular fluid. In essence, this creates a greater stockpile of calcium in the sarcoplasmic reticulum. In our example, we now have 49 calcium ions in the sarcoplasmic reticulum when we started with 45. When we have a subsequent action potential come down that plasma membrane of that myocardial fiber, what that's going to do is open, again, our L-type calcium gate, but still 5 calciums are going to come in from the extracellular fluid. A lot of students are tempted to think only 1 would come in, but remember it's based on gradient, and so about 5 will still come in. But now, instead of releasing only 45, calcium ions from the sarcoplasmic reticulum, we're going to release 49 calciums. So this gives us more calcium in a subsequent twitch. More calcium equals more calcium bound to troponin equals more myosin heads finding binding spots equals more tension generated in the twitch. So as you can see, supercharging that calcium ATPase actually achieves both of our objectives. It shortens the twitch, but it also increases the amount of tension that is generated in subsequent twitches. So increasing the speed at which calcium ATPase works, again, increases the tension of that twitch, but also shortens it. Both of these collectively are important in increasing stroke volume. The shorter twitch, interestingly enough, means that there's more time for the ventricle to be relaxed, which therefore allows more blood to flow into that ventricle for the next stroke. All right, this is our last image, and this is directly from the text. It basically goes through a lot of the mechanisms that I just went through. It looks at how the sympathetic nervous system is going to impact the stroke volume. So when norepinephrine binds to beta-1 receptors, don't worry about the next steps, but ultimately what we're going to get to is on the right side of this chart where it says increase calcium ATPase. That's the big takeaway. It is going to increase the speed at which calcium ATPase works. And you can go ahead and follow the next steps. It's basically exactly what I've been saying. It leads to a shorter twitch, while also leading to more calcium stores, which leads to a more forceful twitch, both of which are going to increase the stroke volume. That concludes our look at how the autonomic nervous system modulates cardiac output.